Good evening. My name is Joseph Kofi Aidoo. I'm a specialist psychiatrist, currently the regional psychiatrist for the Greater Accra region. Um, I currently work at Rich Hospital, but I'm a long-time friend of Ghana Canada Hospital. I've been with Ghana Canada since 2017. So occasionally, when there's the need for a consult, I come to Ghana Canada to see whoever it is and help out. Today, we want to talk about depression. And depression is a term that is used loosely most of the time. When people get sad, they say, "Oh, I'm depressed. I'm feeling down. I'm feeling low." But when we talk about depression, it has got to do with the mood. And when we say mood is a pervasive, emotional, persistent feeling that has been there for at least 2 weeks. So your mood is what has been pervasive for at least the past 2 weeks. So maybe today you are happy. But if for the past 2 weeks, majority of the time, let's say 10 out of 14, you were unhappy and like you were feeling down most of the time, we'll say that you have been depressed. If you have been happy throughout and maybe just a day out of the 14 days, you feel down, it means that you time it like you're okay. You're okay. So when we say depression, it's it's a very common disorder, and the prevalence is about 5 to 10% in primary care settings. And they rank fourth in disability worldwide. When we say disability, it means it is the number 4 disease or disorder that can prevent people from functioning at their highest level. So, of all the diseases in the world, depression is ranked fourth. It means that when people have depression, it affects their function. What we mean function, as in their social function, their occupational function, their educational function, everything that you are supposed to do when somebody is diagnosed with depression, it really affects their function and they may not function at their optimum best. And the prevalence of depressive symptoms may be as high as 30% in the general population. So for every 10 people, there are about 3 people who may have depressive symptoms. So it is very common than we normally think. Just that in our part of the world, we don't talk about mental illnesses, we don't talk about mental health. So everybody deals with this because we have normalized abnormal symptoms. And sometimes by the time people get to us, they are the severe stage of the disorder. And with depression, women are affected twice as much as men. So, like I said, the proportion of male to female is 1:2. It means that for every 1 male, 2 more females are likely to suffer from depression. And the rate in general population is about 10 to 20%. The general risk factor is that with families who have high rates of anxiety disorder and neuroticism, the issues of depression, the rates of depression is higher. In the sense that there are certain families, they are very, it looks like all of them are timid, like they are afraid, like nobody wants to take any risk in doing anything. And they are always anxious, they are always on edge. Everybody is trying to be super cautious. For families like that, there's a higher risk of people getting depression. Also, childhood experiences like the loss of a parent. Studies have shown that if somebody loses a parent before the age of 12, most of the time they are likely to develop a depressive episode later on in life. Lack of parental care, when people do not have enough care from the parents, they don't have enough parental love. When people grow up with parents who are either alcoholics or engage in social vices. Maybe they are arrested, they are put in prison, or they are always fighting in the house. And childhood sexual abuse. These are risk factors for depression. Other risk factors include social circumstances, where marital status is one of the social circumstances. So studies have shown that for men, married men are less likely to be depressed. That a man is more likely to be depressed when he is single. So for those of you who are single on the call, it is not good for a man to be alone. However, although marriage is a protective factor, Divorce and separation makes the risk higher. So marriage will protect you, but it is only good marriages that will protect you. If you're in a toxic marriage or relationship, the rate of depression is higher. And it is the same with women. There's a study by a man called Brown and another person called Harris. And they found that if a woman had 3 or more children under age of 11 and they lack paid employment and they lack a confiding relationship, studies have shown that such a woman is more likely to be depressed. So a single mother of 3 children, all the children are less than 11, she does not have a proper paid employment. The risk factor is high that this woman may have a depressive episode. Adverse life events, like particularly a loss event, in vulnerable patients, in the sense that maybe the person already has an underlying medical condition. He has a stroke, he has other things, and he loses a loved one. Already the chronic disorder or the physical illness puts the person at risk of depression. When they lose somebody even around that time, they are more likely. So that's why I tell people that when people who have a chronic illness like diabetes, hypertension, and they come to the general clinic and you take a social issue and they have lost a loved one in recent times, about 2 to 3 months, it is very important that you at least refer them to see a psychiatrist or a psychologist. Not because maybe they are symptomatic, but just for them to have a chat with the person so that the person can really voice out what they are going through. Physical illnesses like chronic pain, for those with chronic back pain, chronic waist pain, chronic knee pain, and all those things, they are more likely to be depressed. Then diseases such as strokes, Parkinson's, and also people who have had myocardial infarction or heart attack is high. Like I said, diabetes and cancer patients. Although family or personal issues of depression are important. So if somebody in your family has suffered a depressive episode, the chances of you also having a depressive episode is high. It does not necessarily mean that you have, but if somebody has had a depressive episode, it is high. So how do we diagnose depression? How is depression diagnosed? Everybody says I'm depressed. So the symptoms should be present for at least 2 weeks. So when we say somebody is depressed, it means that these symptoms are persistent throughout the day for at least 2 weeks. So it's not that you have like a few days where you are not doing well, but the symptoms have to be persistent for at least 2 weeks. And they are what you call the core symptoms. And these symptoms you are feeling are not secondary to the effects of drug or alcohol. Because sometimes when people use drugs like the stimulant, like cocaine and other things like alcohol and all those things, when they don't have the drug, they have this low feeling like they don't have the energy to go forward and they are not happy and all those things. That's not what we are talking about. But if these symptoms you are feeling is not because you are using a substance or it's a medical disorder or because you are just mourning somebody in the interim within the first 3 months, within the first 2 months of a loss of a loved one, then we can say it's depression. And these symptoms are so significant that they may impair social, occupational, and general function. Like I said, they bring disability. So what are the symptoms? The core symptoms are a depressed mood. A depressed mood is a low mood where there is nothing to cheer you up. So it is present most of the day, nearly every day, with little variation and often lack responsive to changes. So you know that sometimes you can wake up in the morning and you're not really happy. Then you get to work and somebody will make you laugh. Or somebody will say something and you can just get into this kind of mood is not responsive to changes. Even when good things are happening, your mood is still the same. There are people whose faces do not change, whether the thing is happy, whether the thing is sad or not. So there may be diurnal variation in mood, with the morning being worse and slightly improving as the day goes on. Anhedonia. So there's a general saying that man is a hedonist. It means that man is a pleasure-seeking animal. In the sense that man has been created to have fun. So everybody has what brings them fun. Some is singing, others is dancing, some is watching movies, some is chit-chatting, others is going to church, some prayer, some is joining groups. When people are depressed, there is a marked diminished interest in pleasure. Almost all activities, nearly every day. So maybe somebody, like you used to be the life of the party at work. Like when you come to work, everybody, oh, Charlie, what's up? Yeah. Yeah, all of a sudden when the person comes to work, you don't even see them cheerful, and it's consistent. You yourself realize that you used to be someone who loves singing, you used to love to join the choir, you used to love to do a lot of things. Right now, you have lost interest. It means that when you are there, nothing even pushes you to go. Like sometimes you don't even feel as if it is important for you to do it again. Then weight changes. Loss of weight when not dieting or weight gain. That is a 5% change of body weight in a month associated with loss of appetite. So either your appetite changes. So it's not everybody who is gaining weight. Oh, Nancy, why you feel? Hey, and I'm why I drew. Hey, if it is unexplained and it's not because the person you ask the person, it's not because your patient comes to you, like you have a friend, you realize that the person is gaining weight significantly, and you ask the person, hey, are you doing something? Are you eating late? And there's nothing like that, but the person is gaining weight. It could be a sign that the person is depressed. If the person is also losing significant weight within a month, and the person is not because the person wants to, now everybody wants to have 6 packs, no pot belly, uh, tummy tuck, everybody wants to look good. If it's not because of aesthetics that the person is losing the weight, or the person is on a particular diet to cut down on the weight, and the person is losing significant weight within like a month, it may be a sign. They have what you call disturbed sleep. So there is what you call early morning wakening. Early morning wakening is waking up 2 to 3 hours sooner than usual. So let's say you your normal waking up time is 5 o'clock. Now you see that when you sleep, it's difficult to initiate sleep. Then after about when it's about 2 o'clock, hey, I'm on a presentation. Yeah. Please, sorry about that. Sorry about that. My girls want to join the presentation. So you realize that you used to sleep and wake up at 5. Now, when you are going to bed, it's difficult. Also, you wake up 2 to 3 hours before your usual waking time. Now, when it's about 2 o'clock, you are awake and you can't sleep again, and your mind will be wandering. It will be thinking about only negative things. And you realize that when you wake up, you are tired and you have this bad headache. And sometimes you are sleeping a lot too. But that one is in atypical depression. Then there's psychomotor. Then there is sorry. Then there is psychomotor retardation or agitation, where you realize that people are the ones who are going to see it. So you realize that you have become very slow. You have become very, very slow. And it affects your thinking. You realize that you're not paying attention. Even it's very difficult for you to meet deadlines. And everything about you is like slowing down. Then there's fatigue or loss of energy. When you wake up in the morning, there's no energy to even continue. Like you have to drag yourself to get out of the bed. And the loss of energy can even present as anhedonia, where people will not take their bath, they will not even eat, not even brush their teeth. For those who are married and even those who are sexually active, there is reduced libido. So I always tell people that if people are always not in the mood, if people are always not in the mood, I'm not in the mood, I'm not in the mood. Husband, maybe most of the time it's a sign that your wife is not doing well. If your husband is not in the mood, not in the mood, it's not necessarily that sometimes he's cheating. It could be that he's going through a depressive phase. Then people have a feeling of worthlessness, excessive inappropriate guilt. They feel that there's no hope for them, feel that there's no, their life is meaningless. Sometimes people have this belief that they are bad people. That is why these things are happening to them. Then, like I said, concentration is poor, you make mistakes. Then there's recurrent thought of suicide. And I tell people that having a suicidal thought is not a bad thing. It is because you are going through most likely a phase of depression or having mental health issues. And people say that we should not talk about suicide. Actually, studies have shown that the more we do more advocacy on suicide, the more people learn that there is help for them. However, we should not give the graphic descriptions of suicide. And that is one of the things we are trying to educate the media on. That sometimes a person may be having thoughts of suicide, but the person does not have a plan. But sometimes when you listen to our radio stations, the graphic description, for example, and a nipa no call and okofa homa, or fa homa no call share dia, or share diano, and or the same diano, so no fake kunya, no jinaso, no bompa, no dignity shame, and or say homano. Somebody listening to it may not have had a plan, but once we start giving the descriptions of how a suicide event occurred, we are giving people plan. And for children who tell you that they are not doing well, they are unhappy, please always check their tablets, always check their phones, check their browser history. Look at what they are reading, look at what they are listening to. Good. Then sometimes you may have a psychotic break where they have delusions. Sometimes they have delusions of poverty, inadequacy. Sometimes they believe that the world, they are not even in the world, a part of their body is rotten. Then they may be hearing voices which are defamatory, telling them that they are useless people, they are bad people, they are guilty. Sometimes they may smell bad smell, they feel as if they have this offensive smell around them. So how do we deal with depression? How do we deal with depression? So depression is prevalent and it often requires a multifaceted approach. So first of all, let me deal with the preventive ways. How do you prevent yourself from getting there? Albert Ellis, one of the prominent psychologists, psychiatrists of our time, mental health practitioners of our time, says that life is ABC, where A is the activation event, B is your beliefs, C is the consequence. He says that your activation event and the consequence most of the time depends on your beliefs. Where your beliefs is how you have been formed, your thinking pattern. So let me give you a typical example. If, let's say, me and Ike, sorry for using you, but I have to use you. Me and Ike go for an audition to sing for Team Eternity Ghana. They are the most popular now. And they don't pick us. And Ike decides to think that, oh, it's because I don't have a good voice, or because maybe I'm not that tall, or maybe is it because I'm not fair? Then they start thinking that it is their fault. It is because of something negative about them. That is why they were not picked. He's more likely to be anxious and depressed. But if me, I say that, oh, Team Eternity Ghana they didn't pick me. How about Eldam Reku? Because maybe if I go to Eldam Reku, yeah, we can do, yeah. Maybe they'll pick me on that. Because I see another option that despite the fact that somebody did not accept me, I know that that is not my end. Because most of the time, especially in relationships, which is one of the major sources of depression, when somebody is not accepted in the relationship, people feel that it is because of their fault. Sometimes people will never appreciate who you are. So instead of you thinking that you are the bad person, you are not good enough, you are not worthy enough, sometimes it is better you move away and start seeing yourself in the good way that God made you, or in the good way that you see yourself. Because most of the time, because of the negative belief about the world, negative belief about yourself, negative belief about the future, you cannot even see the things that are good around you. Then you begin to produce stress hormones, and these stress hormones will go and trigger other hormonal changes. Then you start having a depressive episode. So one of the ways to prevent depression is that know yourself. And it's not, you have to understand there's not everybody who appreciates you for who you are. So sometimes we expect too much from people who have not received what you're expecting. People only can give what they have received. So sometimes you expect the person to compliment you and say, your dress is nice, and then the person is not giving you a compliment. Sis, you are worrying yourself too much. Bro, stop killing yourself trying to impress people who will not reciprocate it. I always say that go where you are celebrated, not where you are tolerated. Because sometimes if you stay in a place where you are tolerated too much, you end up getting depressed and anxious. The second thing is that have realistic expectations of yourself. See, We all can buy a cyber truck. It's not everybody on this call who will buy a GLE. It's not everybody who will drive a V8. Some of us will have to manage with our Kia Rio and be content with our Kia Rio. That is what our effort has brought us. Because most of the time, people get depressed because of unrealistic expectations. You put so much pressure on yourself. Because motivational speakers are telling you, work hard, then you make it. But sometimes you know that you are giving your maximum best. And your maximum best, you have reached your peak. And unless maybe you get another job which will be paying you more than that, you cannot go again. Sometimes it's good to say, I'm glad I could make this and survive, and at least my children have enough. Sometimes unrealistic expectation will make you jealous. Unrealistic expectations will take you to places where you don't want to be because you will not even appreciate what you have. Then you start looking down on yourself. And the more you look down on yourself, that is when you start developing emotions of unhappiness. The unhappiness will become consistent. Then you have a low mood. The low mood will make you lose interest in even your job. Then you start having thoughts of self-harm. Then your libido and appetite will go in, and then all of a sudden you can't even function again. So have realistic expectations of yourself. And for children, don't superimpose your beliefs. You are supposed to guide them and be truthful to them and be honest to them, but don't live vicariously through them. Don't tell them that you are first in class every time. You are not, because all your classmates are also saying the same. So if somebody does not do these preventive measures, does not deal with stress, does not deal with expectations, does not take everything personal, that when things happen, it's not always about them, then we make a diagnosis of mild depressive episode. When you have 2 or 3 symptoms of what I told you, it is mild. And mild depressive symptoms, sometimes you can function. So a lot of people in the corporate circles, you live with mild depression for a very long time. But mild depression, you can function. But the moment you don't have work again and you retire, then you enter into a severe depressive episode because at that time, your coping mechanism was work. You are unhappy, but when you go to work, at least you get to fulfill something and you come home, it becomes a routine for you. So when you have 2 or 3 symptoms, maybe a low mood, maybe loss of libido, and maybe poor concentration, small, you are okay. That's 3 symptoms. So you function. For moderate to severe, you're having more than about 4 to 5 symptoms of what the things I said. That one, you may have to do medication and psychotherapy. If it is severe with suicidality, we may have to do what we call electroconvulsive therapy. So for psychotherapy, there are psychotherapies such as cognitive behavioral therapy and interpersonal therapy. And for cognitive CBT, it has been noted to reduce the relapse risk even after treatment. And CBT is that the disparities, especially like what I said about you thinking that you're a bad singer, Ike is a bad singer. We try to deal with the cognitive distortions in your brain. So we ask you questions and we talk with you. Then we open another angle for you to know that you are somebody that is doing well and you are not doing that bad. Interpersonal relationship psychotherapy will deal with relationships that you have had and how we can make your relationships not affect you so that it will prevent relapse. For pharmacotherapy, there are drugs. And I always tell people that no psychiatrist wants to put people on medication. I think that sometimes most people think that, oh, psychiatrists always want to put people now. We're actually not interested in putting you, but most of the time, by the time you people come, you are at the severe stage. And at the severe stage, we may have to get something to augment your mood before we can even do the psychotherapy. Then we taper down on the medication for you. Thank you very much. We will pause for discussions.
Thank you, Dr. Aidoo, for such an insightful presentation. I believe everyone has enjoyed this presentation and we want to open the floor, as Doctor has said, for discussions. If you have a question, kindly put it in the chat box so that we'll read it out and then get some good responses. Thank you.
Okay, somebody is asking, do you have internship opportunities for undergraduate psychologists? Yes, I do. A few of the Lagos students were with me at Rage last during their vacation. So you just have to maybe get my contact after the program, and you text me. Then I'll refer you to the HR so that during your vacation you can come for the internship. Good. Then somebody's asking, can aging cause depression? So aging necessarily does not cause depression. However, like I said, adverse life events. As you age, you'll be losing loved ones. As you age, you'll be having chronic diseases, most likely. As you age, you are at risk of losing family support because you are most likely to be lonely because everybody leaves you. These risk factors is what will precipitate the depressive episode. And sometimes for people who are elderly, we have what we call pseudo dementia. Depression may present as a dementia, although not a dementia, because you realize that they become more forgetful and they will be missing their keys. They may start put something on fire and forget that they were cooking something. So aging necessarily does not bring, but the risk factors increase. The number of factors that predispose people to depression increases with age. Yes, so that's that.
Thank you very much, Dr. Aidoo. So please, if you may want to also ask the question in person, you can equally do so. Then when you raise your hand, we will call you and then you put your question across. Thank you. We are still waiting for more questions in the chat box.
But whilst we are waiting for questions in the chat, one of the things I also tell people about mental health is that it's okay not to be okay. It's okay to have a bad day. I think that sometimes we have been told that we should have positive confessions and we should always try to be good and everything. See, if you read most of the religious leaders, most of them went through a bad patch, and all of them came out good because they had other people to support them. It's not you are not weak if you go through a period where you 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 go through a period where you are not doing well. Sometimes we are too hard on ourselves. Yes. Nana also says that thinking too much causes depression. So what are you thinking about? So it is not thinking too much that causes depression. It is the things you focus your thoughts on. So if you are always thinking about how negative your life has been, how negative the world is, if your thought is filled with negative things and you cannot see any positive outlook in your life, you are at risk of depression. So it is not thinking too much that makes you get depressed, but it is the kind of things that fills your thoughts. As if you are thinking that you are not a beautiful lady, you are not smart, you are not intelligent, you cry, you are useless in life, and all those things. You are more likely to be depressed than the next person who is thinking, seeing through everything, see both the negative and the positive, and says that yes, I may not have everything, but at least I have this going for me. Somebody's asking, is there a difference between stress and depression? Yes. So stress um is the body's response to too much to work related duties that has not been properly dealt with. So when we take on too much and we don't take the appropriate time to rest our bodies, that is when we become stressed. So stress is you have overworked yourself and you are tired and you are breaking down. However, if stress is not dealt with, one of the consequences of stress will be a depressive episode. Yes. So burnout can lead to depression. Once you are burnt out, there's a chance that you may be depressed. Because most of the time, if you are burnt out at work and the rewards is not really proportional to the effort you are putting in, you are more likely to be depressed. Doc says that can one be depressed and not even know he or she? Yes. So that is why we gave the symptoms. Some of the symptoms will be you are losing interest in work. You wake up, you don't even want to go to work. There is low libido. Your appetite is changing. You are sleepy. You are not sleeping well. It may not necessarily be of a low mood or you are sad, but because it's not low mood, you're actually having moderate to severe depression. That's why we use the number of symptoms you have. to diagnose, not just how do you call it? Having the low mood. Good. Exercise, yeah, exercise helps. So one of the things that keeps people is that exercise actually helps in blood circulation through all the parts of your body, even to your brain. So once you can exercise, it means that one, you have been able to break the barrier of the low energy, and at least you have an interest in something, and it keeps you going. Also, when you exercise, you release natural endorphins, which help to mop up all the other stress hormones that will predispose you to um, having an episode. Kwesi Jare is asking, could this be arranged on a monthly basis to enable participants provide feedback from what they hear? That one is up to Ghana Canada Hospital. Uh, so are you trying? I don't know if it's about the mental health focus. So that maybe every month people come and tell us like what they have learned and how they are going through it. So if you can please give us a feedback from your question. Can you tell us common myths people believe about depression? Yes, people believe that depression is for weak people. Depression is for weak-minded people. If you are weak, you'll be depressed. If you are not hard enough, you'll be depressed. But funny enough, a lot of men are going through depression. That is why men die by suicide more than women. Although women get depressed more than men, men die by suicide 3 times more than men. Good. So that is one of the myths, that depression is for weak people, and that depression does not have treatment. People, if you are depressed, you cannot come out. You can come out of it. A lot of people have come out of it. And another myth is that if you are depressed, they will put you on medications out for life. It's not true. Most of the time, once people do well, we titrate the doses to 0. Then we encourage lifestyle changes and other things. So once they are seeing the symptoms, they should also see us. So can you throw light on post-traumatic responses and change the behavior and personality of an individual after surviving? For instance, someone becomes less sensitive and compassionate as a way of shielding themselves or falling back to depression. Okay, like I said, we were all created. We were all created to be protective of ourselves. Once we lose that defense mechanism, we are more likely to get hurt. So if, let's say, it was a trauma from marriage, for instance, and you manage to leave that um, the toxic relationship, and now you are doing well, one of the things you do is that it teaches you. But first of all, it is not about becoming less sensitive to, oh, you see, I'm having a presentation. When I finish, please, sorry, when I finish, I'll come and I'll play. Okay? Yeah. It is not about being less sensitive to and compassionate about to others. However, it's about you becoming more aware of yourself. That's the next time you are there and maybe somebody is trying to play tricks on you and lie to you and flatter you, you know that, nah, this one won't wash. So you are more self-aware. So it's not that you're becoming less sensitive. It is you becoming more aware of yourself, that I've been down this road before. I know what's the last time where it took me when I trusted people and I gave them all my money. I lost everything. Now I'll need sureties. Now we may have to sign a contract. Now we may have to do this. I'm not. So it is rather you becoming more aware. It is not necessarily a traumatic response. It's actually an awareness that you have come of yourself. And that is what we encourage, that once we do the cognitive behavioral therapy, we let you become aware of your strengths and your weaknesses so that the next time it is coming, you know how to deal with it. Yes. Can depression lead to low libido? Yes. One of the signs of depression is low libido. So low libido may be a sign of depression, although there are other factors that can cause low libido, but low libido may be a sign. In our world today, men are not supposed to show weakness in any form. Finding the balance as when to open up and when to, can you advise? Yes. So I don't know how many of us are. I'm an account, so please permit me to use this. Have you heard most of the account proverbs? Etuotua esibemabo. Bema na nume dura enyo. Bema nsin so man sa waham. Bedi akudi fatana e fatana kuno. Almost all the proverbs about men is about death. It's about something painful that a man has to suffer. So culturally, we have been shaped that way to think that if you're a man, you cannot feel pain. And that is why most men die early. Because most men don't talk, they die silently. They have lost weight, they have lost appetite, and their sugars will be all over the place, they are hypertensive because most men don't talk. I always tell that Charlie, we should have a group of friends that you can be naked around. A group of friends that you know will have your back as guys. I tell you that if all your friends who are guys, the only thing they talk about is Charlie, let's go and drink, let's go and have fun, and you cannot talk about sensitive issues. You have to change your circle. We as guys have to. The ladies, the women do that a lot, and it helps them. Men have to find a way to talk about sensitivity. That Charlie, bro, I know they do well. Like I'm not happy. I'm not doing well. Sometimes just opening up alone will heal you. The sad part is most of your guys after you are fine will tease you with it, but in the end you have still opened up to. And guys, we have to. Men's mental health is important. So men, we have to prioritize our own spaces, create our own space. Because truth is that it's very difficult for a man to open up to a woman when it comes to issues about difficulties in mental health. But a man it will be easier for him to talk to another man. Although you should be comfortable, you should also be matured enough to talk to your partner or whoever it is about what you are going through. So we should all be. Yes, and sometimes I tell people that you are better off being fine. People seeing you that actually you are people having the thoughts about you that you are weak, which won't watch because they don't feel you, they don't do anything about you, and you being fine than trying to prove other people right that Charlie, you've got this. Yeah. How can workplace create healthier environments for men to open up? First of all, men have to start seeing themselves actually they are human beings first. And if you're a man, don't take on things you cannot do. I've seen this syndrome among most young men that, let's say, the job is supposed to close at 5 and there's extra work. Then they'll tell, oh, the ladies can go home. The guys, you stay, you are guys. And he say, okay, yes, we'll do it. What is good for the goose should be good for the gander. If you are tired, respectfully, I'm not saying you don't work hard. I am saying that we should rather have open spaces for people to be able to express themselves. One of the things that we should also be careful is that it's not everybody that has the good intention of even what they're asking. There are people who want to take advantage of the system and not work, so they just use mental health as an excuse. So, in as much as we are creating the spaces, we who need the spaces should also try and protect that space so that others will not abuse the space for us to lose that space. Yes, I've talked about some of the myths and misconceptions about mental health, about depression. Also, on mental health, periodic sessions on this platform will be helpful. Okay, thank you very much. I'll talk to Ghana Canada Hospital and we'll see what we can do about that. Maybe we will see what we can do. Thank you, Enoch, too. How can someone differentiate between feeling sad and being clinically depressed? Yeah, so I explained it that for you to be depressed, when I started, I said that depression is a constant feeling. These symptoms I'm telling you, they are there persistently for about 2 weeks. It's not just a day's thing that, you support Manchester United. I don't even know why, as a young man, you be supporting Manchester United. And you support Manchester United, and yesterday they lost. So in that period, you'll be sad, you'll be angry. Aha, you get it. So that period of one day where you are sad does not mean you are depressed. For depression to happen, it has to be persistent throughout the day for about 2 weeks, and it does not respond to changing circumstance. You may be sad with Manchester, but actually, if you see how fine your wife is and is passing, it will change your mood. You understand? But for depression, nothing like really changes how they are feeling. Yeah. What advice will you give to someone who wants to support a loved one with depression? So I always say that one of the things you always tell people is that you tell them that it is okay not to be okay. And don't superimpose your belief system on them. We are all different. We are all built different. We are all wired different. One of the things you say that I'm here for you. If you need me, I'm here. I've seen that um, things are changing in your life, and I think um, if you want to talk to somebody, I can be of help to help you get that. So offer the help to them. Don't force them. Don't make them look as if they are unspiritual and they are bad people and they are not praying enough. Yes, let's try and be more. I always say this: when somebody needs help, ask yourself that the way you are talking, what you are telling what you are telling the person. If you were on the other side, will you appreciate it if somebody is talking to you that way? That's how I always teach it. So what the advice you want to give to a relative or a friend, ask yourself that the way you are saying it, if you were on the other end, somebody said that to you, how will you take it? Yes. So for the person who said, so for the person who said that they needed to do an internship, please send me a private message and I'll send you send a private message on the call and I'll send you my number so that you can reach out. So what role do medication and lifestyle changes play? Like I said earlier on, they play a significant role. They play a very an important significant role. Normally we merge them. We merge all of them so that we look at the patient in totality. We don't just start like saying, oh, you are putting on medication. We look at every patient is different. So we look at the totality. Some we have to modify lifestyle change. Sometimes some of them they have to leave certain families. Sometimes they have to leave certain spaces. Sometimes they may need some days off. Some of them have to do medication. So we do biopsychosocial. So it's basically everything involved to make sure the patient is fine.
Okay, thank you very much, Doc. Please, are there any more questions? Are there any more questions? So, at Ghana Canada Medical Center, our team consists of highly trained physicians, nurses, and then healthcare assistants who are always on standby to give you the best care you ever needed. We also have Ghanaian and then non-Ghanaian experts practitioners on board who are practicing at our center. And our services also range from a 247 general care, eye clinic, internal medicine, pediatrics, and neonatal new laboratory services, obstetrics, gynecology, dietetics, ear and nose and throat, general surgery, midwifery, postnatal care, immunization, ophthalmology, pharmacy, dialysis, urology, and then a canteen as well. And it being a private facility, we also have a couple of insurance services that we do take. We take Acacia Health Insurance, ACE Medical Insurance, Apex Insurance, then Cosmopolitan Health Insurance, Equity Health Insurance, Gov Health Insurance, Glyco, Metropolitan, Nationwide, Phoenix, and then Premier Health Insurance. Yeah, and then Premier Health Insurance. As part of our services, we also render services to corporate institutions. Some would want to us to become their retainer facilities where we render services and then we bill them at the end of the month and then they pay us within a space of 30 working days. We want to also bring this one on board to your attention. Then there are a couple of contacts that we have equally shared for you to get in touch with us if you may need any of these services. And then we also do medical screening for corporate institutions as well. Yeah, if you want us to give some health talk to your staff and run screening at the same time, we are available for those services as well. And after the screening, we have a discounted labs that we also run for your staff as well. So if there are no questions, We want to say a big thank you to Dr. Aidoo for this great presentation. It was very educative and highly insightful. Thank you very much, Dr. Aidoo, for your time and then the education that you have given unto us. And we do this webinars each and every month. Every month we do webinars, but I've seen a brother request for a monthly kind of presentation on depression alone. We will escalate it to management and then see the outcome. However, we are with you every month for such presentations as this and others. Yeah. And we want to say a big thank you to everyone. We have a page. We have a page where called Friends of Ghana Canada, where our presentations are recorded and posted to. And then any subsequent presentations that are upcoming, you are updated from that place. We have a WhatsApp page. So we will soon share the link and then you may tap it and then join the page. And then I believe you will get more information on our activities every now and then. So thank you very much. Thank you very much.
Hello, Isaac. Hello, good evening, Isaac. Can I say something small?
Yes, please. Yes, please.
Okay, good evening, everyone. Thank you so much for joining today's webinar. Thank you for being a loyal friend of Ghana Canada Medical Center. So next month is Pink.
We can't hear you. We can't hear you.
We can't hear you.
Okay. Hello. Is it better now?
A bit.
Hello, is it better? Hello?
Okay.
Hello?
It's a bit okay, but it's still faint.
Okay. Sorry about that. But it's a quick one, actually. We have 2 minutes to go. So thank you so much for joining today's webinar and for being a loyal friend of Ghana Canada Medical Center. Thank you, Dr. Aidoo. Thank you, Isaac. And for everybody on the call, God bless you for being part of today's webinar. So God willing, next month, it's Pink October. If you want us to come to your facility to screen your staff, just call our hotlines and ask of PCC, and then we will sort you out. So if you want us to come to your company to talk to your staff, anything breast cancer, please get in touch. Call any of our hotlines and we'll sort you out. So next month is Pink October. Thank you so much for joining. And just like Isaac said, every month we have very insightful topics to discuss with you. So have a good night and yeah, stay blessed. Thank you.
Thank you very much. So we have posted a link for the WhatsApp group. You can kindly click on it and then join our page called Friends of Ghana Canada. Enjoy the rest of your night. Bye for now.